Hello, I'm Dr. Clemens Budde, and I'm a nephrologist who specializes in treating patients with TSC. Now I would like to share my experiences with you. Ultrasound, MRI and CT are all techniques that can be used to identify AMLs, renal cysts and other renal manifestations in people with TSC. The technique that's used often depends on availability, but typically, in my experience, a nephrologist working with a radiologist would use ultrasound for the initial assessment of both adults and children. The ultrasound would show the general appearance of the patient's AMLs or cysts and allow for the confirmation of TSC. To capture more specific information, like the size and localization of a lesion, an MRI or CT would be necessary. Knowing the initial lesion size is valuable since it can provide a staging benchmark for follow-up, confirm growth tendencies as shown on ultrasounds, and alert you to anything urgent, such as large AMLs which have a risk of bleeding and may require clinical intervention. It is important to note that in pediatric patients and anyone else who wishes to avoid radiation, MRI would be chosen over CT for additional screening, as CT requires small amount of radiation exposure. From a nephrology perspective, the monitoring of TSC patients will vary. For example, if a TSC patient does not have any renal lesions or very small or single lesions, I would monitor once a year with imaging, and I would also measure the renal lab parameters, including creatinine and proteinuria. No consensus exists on serial renal evaluations for patients with TSC. However, it is suggested that renal ultrasound may be given every 2 to 3 years before puberty and annually or semi-annually after that.